from the station that's on your side. This is Channel 7 News Daybreak.
All right, 6:23 is the time. Welcome back into Daybreak. This morning, we're joined with Baptist Health Cardiologist Dr. Scott Davis with new research on vaping and if it can increase the odds of suffering a stroke, a heart attack, or heart disease. New information always coming out about this. Dr. Davis, thanks for coming in this morning because it's something that's really become popular over the last few years.
Yeah, the data on vaping and on e-cigarettes continues to emerge. And most recently, the U.S. Center for Disease Prevention and Control, they do a survey periodically, not quite every year, but periodically. And in 2016, they did a behavioral risk factor study looking at 400,000 people across the U.S. All 50 states were represented. And they look at behavioral risk factors and prevention as far as people's just activities and day-to-day lifestyle, right? And they looked specifically at the use of e-cigarettes. And of the 400,000 that were studied, some 66,000 were e-cigarette users. And within the last 30 days, like 3% of adults, 11% of teenagers. And we'll come back to that number because it's a growing number.
Yeah.
And what they found looking at the data then, there was amongst the e-cigarette users, a 71% increase in stroke, a 59% increase in risk of heart attack or angina, and a 40% increased risk in heart disease. And so the American Heart Association continues to take a stand that, look, we really want to look at e-cigarettes. We don't want to be lulled into this safe alternative position that sometimes we've taken, and we really need to look at it as though it were simply another tobacco product. And so as data continues to emerge, I think folks need to really look at it as maybe not the best alternative for getting off cigarettes. Just cold turkey is still the recommended way to do this.
Sure.
Because it puts you at an increased risk. Now, granted, this is observational data. This is not randomized data where you would set forward to look at stroke risk and randomize people that are e-cigarette smokers versus non-smokers. But nonetheless, it is very telling data, and it's very sobering data as far as the way we are continuing to view e-cigarettes.
All right, about a minute left. Tell me about more teenager use.
Yeah, right.
The increase in that is skyrocketing.
So you're ready for the big stat.
Yeah.
Between 2001 and 2015, e-cigarette use amongst teenagers is up 900%.
My goodness.
It really is crazy. And so to have this notion that, well, if, we're not, I mean, a big majority of people that use e-cigarettes are also going to use regular cigarettes, and we know that harm and that risk.
Sure.
And again,
that's well documented.
And again, the thing that I tell people, it's kind of like looking at things from perspective. It's not one day, 1 week, 1 month. It's month after month, year after year, that all of a sudden you're moving a ship in a very different direction starting in your teenage years, that you start seeing the byproducts of that as far as lung disease and heart disease and stroke risk. And so I think the Heart Association is doing a great job of really putting this message out. But from a political standpoint and looking at the government, I think we're really going to have to rethink the way we handle the marketing of these e-cigarettes, and especially how they're marketing to teenagers with, the bubblegum flavored e-cigarette stuff. So
sure.
Very, very, very sobering data and stuff that we really need to pay attention to. More studies will be coming out from the Heart Association, from federal studies in the future, in the immediate future.
And you mentioned political standpoint. There is now talks of a bill which would raise the age here in Arkansas to 21. We'll talk about that coming up in just a little bit. Dr. Davis, thank you so much for coming in, as always, and bringing this new research and new data to the table, to your table in your living room, right here on Channel 7 Daybreak. Baptist-health.com for more resources, or call 1-888-BAPTIST.